Our science correspondent George Lee joins us now. George, as we saw there in Laura's report, strong message coming from the briefing there today that better times are coming, but that just for the moment, the situation is still a bit dicey.
Well, a bit dicey, but it really depends on how people behave in the coming weeks. Now, they're very much of the opinion that the vast majority of people really stick to all of the public health measures, but that there's a small minority of people who are increasing social contacts and that they're saying they're taking increasing risks. Not so much that what they're doing is any different, but that the variant that we're dealing with is so highly transmissible. There's about double the impact in terms of the risk in terms of infecting close contacts than there was before. That's the B117 variant. Now, what they're really focusing on is trying to explain to people the huge importance of delaying this lifting of social restrictions and the huge importance of delaying an increase in social contact. And so what they said is they have got mathematicians from so many universities behind what they've produced today to produce this really in-depth view in terms of what the scenarios would look like. And what they're saying is, as we are right now, between now and the end of September, we could have up to 80,000 new cases on the basis of what we're doing. But that could increase to 200,000 if we increase the level of social contacts just by a small bit, and maybe to 578,000 if we have a little bit more of an increase in social contacts. And they analyse and they said, well, hold on, if we just delay that increase in social contacts by 4 or 6 weeks, what impact would it have? And they found out then, according to all of this analysis done by all of these mathematicians in all of our universities, and they said we would save, in terms of the 8-week scenario, up to 400,000 cases of this disease in the country, and significant amounts in terms of even a 4-week delay. So to try and get the message to people seems to be what they're saying today, that the delay in terms of increasing social contacts has massive impact in terms of the number of cases that we would have, and the huge impact in terms of its impact on our hospitalisations and intensive care. They say if we increase our social contacts now by a small amount, we could have up to 1,600 people back in hospital by the middle of June. And we could have up to 500 people in intensive care. Now, they don't think that that's going to happen because they believe that people do listen to their message. And they don't believe necessarily that we're going to have a fourth wave, again, because they really do believe that people listen to the message. But what they're trying to point out to people, and particularly those who don't want to listen to the message, is that these are the stakes at play. We can really prevent all of this with just a small delay. And they have built into all of that analysis the impact of vaccination. And so the whole thing they're looking at is this race and this trade-off between people's behaviour and how fast these vaccinations can get out. And so they're saying just delay for those few weeks and it would have an enormous impact. And that's the very strong message coming from the briefing today.
OK, George, thanks indeed for that.